Hi, I'm Dr. Brooke with Airrosti. So, you've been having arm pain. Well, let's go ahead and talk about it. Arm pain is typically described as an achiness, a tightness, or some form of radiation from the neck all the way down to your fingertips. Now, whether this is something you've been struggling with for a very short period of time as a result of an injury, or you've had this for a very long time and you have no idea where this pain came from, Airrosti can help. There are multiple injuries that can contribute to arm pain, so let's go ahead and talk about that now. So the first thing we're going to talk about is a herniated disc. What a disc is it's basically a pillow in between your spinal bones. These pillows allow for your neck to move, to bend, but when one of these discs becomes compressed, oftentimes patients are going to present with some form of radiating, tingling, numbness, or a burning sensation all the way down to the fingertips. This isn't to be confused with nerve pain though. When a patient presents with a pinched nerve, this can happen anywhere in the neck, in the shoulder, or the elbow, and it's as a result of the bones or the muscles rubbing up against that nerve. Patients will also present with some form of radiating discomfort. So the next thing we're going to talk about is tendinitis. Tendinitis occurs whenever the tendons become inflamed. The two common types of tendinitis we see in the office are bicep tendinitis and lateral epicondylitis. The pain in the elbow, called lateral epicondylitis, is more commonly known as tennis elbow. People with tennis elbow are going to have pain whenever they lift things or basically when they're using their arm in general. People who experience bicep tendinitis, this can be a form of overuse, and people whenever they try to reach their arm overhead are going to experience discomfort. The next thing we're going to talk about is a sprain strain. A sprain will occur in the ligaments and a strain will occur in the muscles. Again, this can happen anywhere from your neck to your shoulder to your elbow all the way down to the wrist. This can be as a result of a direct trauma or it can happen over time. Patients oftentimes will present with achiness, discomfort, bruising, or swelling in the muscles. Oftentimes, traditional healthcare will approach arm pain by suggesting some form of ice, heat, or compression. They may even prescribe an anti-inflammatory or a muscle relaxer. Another option is an injection at the site of the injury. Here's how Airrosti is going to address your arm pain. First, you're going to spend a full hour with us in the clinic. We're going to take you through a comprehensive evaluation, which will come up with your diagnosis. After we have your diagnosis, we're going to be doing a specific hands-on manual therapy to the area of your concern. Once we're done with that, we're going to take you over to the active care. During active care, you'll be performing exercises and stretches to help you manage this injury at home. We hope this information was helpful for you. If you or someone you know is struggling with arm pain, reach out to Airrosti. We'd love to help you get out of pain. We offer in-person appointments as well as telehealth. If you'd like to know more, go ahead and click right here. Don't forget to watch some of our other videos right here, and then subscribe to our YouTube channel right here. Thank you so much for watching. We'll see you in the next video.